Hello, my dear friends. Welcome back to new session of Hospital and Clinical Pharmacy. Myself, Miss Malvi Rajendra Bhavsar, Kekiwak Institute of Pharmacy, Nashik. So, welcome to the part 2 of a new chapter which we had covered in last session, nomenclature and uses of surgical instrument and hospital equipments. Here, you will be learning about different hospital equipments and their uses of surgical instruments. So, in last session we dealt with different types of instrument including scissors, forceps, rubber catheters, etc. So next instrument is miscellaneous instruments. That first is tongue holding forceps, which holds the tongue during surgery. The jaws are round with a serration and handles carry bows and catches. This is tongue holding forceps. It has a jaws and carries catches and bows. Then sponge holding forceps. They are used to hold the swabs for antiseptic dressing before surgery. They are 9.5-inch long with the finger bows and catches. These are the finger bow, the catches, and it is sponge holding forceps. Then bone cutting forceps, which cut the bone, which has a sharp blade and a handle with or without lever arrangement. These are mostly used for cutting the bones in the orthopedic surgery. Then bone holding or lion forceps. They have stout, blunt teeth on the blade to catch the bone, and it resembles to the lion's jaw when they are open. Hence, they are named as lion or bone holding forceps. Four blunt teeth they have. Okay, this diagram shows a bone holding or lion forceps. Then piles holding forceps. They are used to hold the pile's mass. They are oval shaped jaws, grooved from inside with no serration. The handle has a finger, bows and catches, and it differs from the sponge holding forceps in not having the serration. Okay, piles holding forceps do not have serration. They are grooves without serrations. Intestinal clamp. They are used to clamp the intestine. The blades are long and thin. They are longitudinal serrations from inside. The handle has finger, bows and catches. This is intestinal clamp. Laminectomy saw. It is used to saw the bone, means to cut the bone. It has a convex saw margin on the table and the blade as a piston grip handle. Then other equipments used in the hospital. They are ECG machine. It is electrocardiogram machine. It takes an electrocardiogram. It is a must for an hospital. These days, multi-channel ECG analyzer machines are available which give complete ECG interpretation and extensive measurement for the instant diagnosis. Hindertron in India markets the Cardovit 83 IC. Then X-ray machine which takes internal photograph and is a part of any radiological department is a great diagnostic tool. Then Doppler echocardiography. In medicine today ultrasound Doppler is increasingly important method of diagnosing human disease and many kinds of health problem. It is non-invasive. It is used to diagnosis of a heart disease. Then we have video monitoring equipment. Many sophisticated hospitals have video monitoring equipment for eye surgery or orthoscopy of knee joint. Then glucometer or a blood glucose meter, a single button operated compact which gives the result of blood glucose or blood sugar in a minute and stores the previous result in memory is known as is now available in many other hospitals also. Then CT scanner. Latest generation scanners, they are also known as computed tomography, popularly known as CT scans, are now vision of medicine. CT scanner find it difficult to analyze instantly moving structures like heart, but now Emetron ultrafast scanner has developed to overcome these difficulties. The scanners are used extensively for head injury, convulsions, strokes, chronic headache, galactoria, mental retardation, meningitis, and loss of memory. For orbit, protopsis, injury, and ear bleed. For ear, otorrhea, cholestromia, ear bleed. For neck, parotid tumor, thyroid mass, change in voice, and non-specific neck mass. For PNS, chronic sinusitis and tumor, abdomen or pelvis, it is used to check the abdominal mass, obstructive jaundice, CA, CBD calculus, TB, lymphoadenopathy, and PU. For spine, it is used to check the fracture, tumor, infection, disc, that is radiating pain in leg, spinal canal stenosis. For extremities or joints, it is used to check tumor, infection, foreign body. And in 3D, it is used for reconstructive surgery of face, H for hip joint and H spine, etc. Ultrasound sonography, it is equipment which gives sonography of uterus. They are very helpful gynecology to know the reason of repeated abortion, fetal condition, fetal abnormalities, fetal surgery prior to birth. Magnetic resonance imaging (MRI) is equipment used in many hospitals for diagnosis of complicated cases. Hospital equipments are now being developed on increasing scale because biomedical engineering is advancing by leaps and bounds. Then lithotripsy. It is a non-invasive technique used to break the kidney stone by laser beam after locating the calculi perfectly. Then other equipments which hospitals have are dentist equipments or accessory, hospital furniture and supplies, laboratory equipment and supplies, medical disposable, paramedical equipments and supplies, personal medicheck kits, personal hygiene products like antiseptic, soaps, sanitary napkins, physical fitness equipments, and medical educational aids. Thank you, dear friends, for listening to this session. See you in the next session, friends. See you. Thank you. Thank you very much.